One thing I really love about working with patients in my own private practice and having time with them is that we can really talk through the nuances of hormone care. One of the areas that I see slipping through the cracks in like corporate widespread menopause care is cyclic progesterone. So if you're in perimenopause, it is probably a wise idea to consider cyclic progesterone. And if your doctor didn't even talk to you about that option, they probably don't know much about menopause. And I would see someone who's giving you all of the options. So let's talk about cyclic progesterone. A lot of patients end up taking it in their follicular phase because they're not paying attention to their cycles. Cycles can be off in perimenopause and it can get confusing. If you are able to tell when you are ovulating, it can be really wise to place progesterone in your luteal phase so that you are mimicking the natural cycle. How might you know when you're ovulating? You might have more clear, sort of egg white clear mucus down there with more blood flow to that area, more libido. You can often use different apps to track temperature as well to give you an idea. And then you want to make sure you're timing progesterone in that luteal phase, which is the second half of the menstrual cycle. So day one of the menstrual cycle is the first day of bleeding. So you bleed, you're on day one, and you're in the follicular phase, you're developing an egg, and then you ovulate, and that's mid-cycle. And then the latter half of the cycle is when you want to be taking progesterone. If you're taking it randomly, it can cause irregular bleeding and really throw things off, and you're not supporting your natural cycle. Yes, you're doing the uterine protection aspect of progesterone, but you're not supporting a quality, healthy cycle that's going to give you the most benefit to your whole body. So if this can be a confusing topic, sit down with whoever is giving you your menopause care and really talk through, what does cyclic progesterone look like for me and my cycles at this time? How can I do it in the best way possible? It's really important that you're at least getting 12 days in the month, and really helpful if you can get those 12 days in of progesterone in the luteal phase.